Hi, this is Monica Reinagel. Thanks for tuning in to the Nutrition Diva podcast. September is an awareness month for Polycystic Ovarian Syndrome, or PCOS, a condition that affects up to 1 in 10 women. So today I wanted to bring you an encore presentation of my previous episode on that topic. Before we get that rolling, I also wanted to share a listener Q&A that was related to my recent episode on nutritional trade-offs. The episode in which I talked about how to choose between two food choices when it seems like either choice has both positives and negatives. After listening to that episode, David posted on the Nutrition Diva Facebook page. He said, "Your podcast on trade-offs made me think of the following question. I try very hard to limit my intake of sugar, but some foods do need some kind of sweetener, and so I'm wondering about what alternatives to table sugar you would recommend. Some are higher in glucose, and that brings with it a higher glycemic index, and others have a lower glycemic index, but they're higher in fructose, which experts say to avoid. So what do you think?" Well, this is a great question. Most sweeteners, including table sugar, honey, maple syrup, agave nectar, and so on, contain both glucose and fructose in various amounts. Table sugar is roughly half and half. Agave nectar, on the other hand, is about 70% fructose and only 30% glucose. These two sugars are metabolized through different pathways. Glucose is absorbed into the bloodstream, and fructose is metabolized in the liver. So agave nectar is going to cause a lower rise in blood sugar than table sugar. On the other hand, too much fructose can increase the amount of fat that's stored in your liver, and that's also not good. So are you better off with a sweetener that's higher in glucose or one that's higher in fructose? As I posted in response to David's question, both the effects of glucose on blood sugar and the effect of fructose on liver function are highly dose dependent. When you're only consuming a small amount of added sugars, you're unlikely to get into trouble on either front. So, as long as you're keeping your consumption of added sugars to the suggested levels, which is 5 to 10% of your calories, and it sounds like David is doing that, it doesn't really matter that much which sweetener you choose. You'll find an expanded version of my answer to David's question, including advice for those who aren't limiting their sugar to 5 to 10% of their calories, on my blog at nutritionovereasy.com. And if you have a nutrition trade-off that you've been wondering about, come post it on the Nutrition Diva Facebook page, and I might feature it in an upcoming podcast. Our show today is sponsored by Nordic Naturals. Nordic Naturals is known for making the freshest and purest omega-3 fish oils. More than 27,000 studies have been completed on omega-3s, making them one of the most researched nutrients in the world. Researched benefits of omega-3s include support for the health of the heart, joints, brain, eyes, nervous system, mood, and immunity. You've heard me talk about them a lot in previous podcasts. Nordic's award-winning omega-3 formulations are not only proven pure and effective, they also taste great. And they apply that same commitment to quality, purity, and efficacy to all of the other nutritional supplements that they make as well. Check them out at nordicnaturals.com, and you can use the promo code DIVA and get 15% off your order. And now let's get on to our nutrition tips for PCOS sufferers. Listener Angie writes, "I was recently diagnosed with PCOS, and I've been trying to learn about it. There seems to be a lot of confusing advice out there, and a few sources suggest that a healthy diet for someone with PCOS is different than a healthy diet for someone without this condition. Is this true?" Well, unfortunately, Angie, you've got plenty of company. Polycystic Ovary Syndrome, or PCOS, is a condition that affects up to 1 in every 10 women of childbearing age. Our own house call doctor recently did an episode on PCOS, which includes a thorough explanation of the medical aspects of this syndrome. In a nutshell, PCOS is characterized by hormonal imbalances, which involve not just the reproductive hormones like estrogen and testosterone, but also hormones that regulate blood sugar, fat storage, and appetite. Symptoms of PCOS can include painful or irregular periods, acne, abnormal hair growth, increased appetite, weight gain, or difficulty losing weight. And women with PCOS often go on to develop metabolic syndrome, which increases your risk for heart disease and diabetes. And the reverse is also true. Women with metabolic syndrome are more likely to develop PCOS. And if that all weren't bad enough, PCOS is also a leading cause of infertility. Now, PCOS is very strongly linked with obesity, and as we've seen obesity levels rise, PCOS has become a more common diagnosis. But there are also lean women who suffer from PCOS. Almost all women with PCOS, however, have some degree of insulin resistance, which is sometimes known as prediabetes. And for more on that condition and how diet can help, please check out show number 113. With PCOS, it's a little hard to tell the chicken from the egg. Does weight gain lead to hormonal imbalance? Or does hormonal imbalance lead to weight gain? Either way, it quickly becomes a vicious cycle. The first-line therapy for PCOS is a diet and lifestyle makeover with the primary goal of improving the body's sensitivity to insulin. And with any luck, this can interrupt that vicious cycle and start a virtuous cycle instead. So here are 4 ways to improve insulin sensitivity. Tip number 1, lose weight if you need to. Weight loss improves insulin sensitivity, and you don't necessarily have to reach your goal weight to get this benefit. Even a modest amount of weight loss can begin to reverse symptoms of PCOS. For example, if you're 50 pounds overweight, losing 10 pounds can make a big difference in your PCOS symptoms, even though you might still be significantly overweight. And for people who have a significant amount of weight to lose, one good strategy is to lose weight in a stepwise fashion. Lose just 5 or 10 pounds, and then practice maintaining that new weight for 2 months before taking the next step down. And you might also find episode number 163 helpful. It's on how to lose weight without dieting. Tip number 2 is to be more active. Exercise is also a great way to improve your insulin sensitivity. It also helps rebalance reproductive hormones, and as a bonus, it can also help with weight loss. A combination of aerobic exercise and strength training will work best. For lots more help getting in shape, check out Get Fit Guy's podcast. It's at getfitguy.quickanddirtytips.com. Tip number 3 is to eat a low glycemic diet. Whether or not you need to lose weight, the best diet for PCOS appears to be one that is lower in carbohydrates, especially sugar and grain-based foods, higher in protein, vegetables, and fiber, and moderate in fat. In fact, I think that's a pretty good dietary prescription for just about anyone. For more specific tips on this, check out podcast number 76 on reducing carbs and episode number 67 on increasing protein. And tip number 4 is to eat regularly, but not too frequently. Although some people claim that eating every 2 or 3 hours is ideal, spacing your meals out more can help improve insulin sensitivity. And I have a lot more on that in episode number 32, How Often Should You Eat? Instead of having a small meal or snack every couple of hours, try to get used to eating a more substantial meal and then waiting 4 or 5 hours before eating again. For tips on how to choose foods that will keep you full longer, look up my episodes on satiation and satiety, which are number 223 and 224. And by the way, I've got links to all of these related episodes in the show notes for today, which are at nutritiondiva.quickanddirtytips.com, and you can also search the entire archive there. Now, most of you know I'm not a big fan of vitamin supplements. I'd really prefer that you get your nutrition from foods. But there are times when targeted supplementation can be useful, and PCOS appears to be one of them. Although the diet and lifestyle changes I just outlined for you are by far the most important things you can do, the following 2 nutrients could be a useful addition to your regimen. The first one is vitamin D. Women with PCOS tend to have low vitamin D levels, especially when they are also overweight. And some preliminary studies have shown that taking high-dose vitamin D as a supplement improves symptoms of PCOS. Now, the doses used in these studies are more aggressive than I would recommend taking without a doctor's supervision. If you have PCOS, ask your doctor whether he or she would recommend a vitamin D supplement and how much. And I've included links to those relevant studies in today's show notes if you want to take those to your appointment with you. And the second supplement to consider is myo-inositol. Inositol is a whole group of nutrients that's often lumped together with the B vitamin family. And one particular form, called myo-inositol, has been found to help women with PCOS improve insulin sensitivity and other symptoms. You can buy myo-inositol as a bulk powder online or from a vitamin store, and the recommended amount is 2 tablespoons a day. Try adding it to your morning smoothie. Finally, there are some drugs that may help, and Dr. Sanaz Majd, our house call doctor, discusses those in her episode on PCOS, and you'll also find that on quickanddirtytips.com. The good news here is that PCOS is treatable and often without medication, but a lot of it is up to you, and making lifestyle changes can be challenging. For extra support from women who know what you're going through, check out the groups and forums at PCOsupport.com or PCOSfoundation.org. There's a transcript of today's show, plus tons of links to related shows and the studies that I mentioned at nutritiondiva.quickanddirtytips.com. Have a great week, and remember to eat something good for me.